Well, I was diagnosed about a year ago with the overfocus type ADD. And I have to say, when I was first diagnosed, I was pretty upset about it, actually. I kind of thought, well, I felt overwhelmed, actually, with all the other things I was thinking about dealing with at that time. Adding in ADD and the diagnosis and what I needed to do to treat it was fairly overwhelming. So the treatment that I started was the Adderall, extended release, about 30 milligrams, and therapy, the combination. And it did help with some of the core symptoms that I was experiencing, mainly obviously the attention, focus problems, but the impulsivity, it really made a difference with, and the obsessiveness. Although there were some times where it actually made the being too focused and too obsessive, it made it worse. I did try the AdCare, which for me actually did work to a lot of the same degree that the Adderall did. It was smoother actually than the Adderall, where I would get breaks in the Adderall where it was working less well and too much at the start. AdCare didn't have that, and I was also able to take AdCare later in the afternoon without the problem of being able to sleep at night, whereas with Adderall I had to be very careful about how late I took it. For me though, the thing that worked the best is the combination of Adderall with the ObsessCare, which I also tried. That seemed to help, especially with the way that sometimes the Adderall would make me over-focused, would make that problem worse. The ObsessCare really helped with that. It helped control that symptom especially. So now I think that that's the best option for me, is taking the Adderall and the ObsessCare. So if you're looking to attempt to try the AdCare or the ObsessCare, you could go to www.care.com. And by the way, I don't work for the company, I just have used the product and it really does work.